My name is Grace, and I've been a registered nurse for 12 years. I was born and raised in Boston, Massachusetts, where I grew up watching my grandmother care for neighbors in our community, never asking for anything in return. That's what drew me to nursing, the quiet strength of showing up for people when they need you most. I moved to Philadelphia 5 years ago to work at Jefferson Hospital, one of the oldest and most respected medical centers on the East Coast. The hospital sits in the heart of the city, surrounded by century-old buildings and the constant hum of urban life. I work the night shift in the surgical unit, and I won't lie to you, it's brutal. 3 a.m. always feels like the darkest hour, when the hospital becomes this strange, quiet world of fluorescent lights and beeping machines. My colleagues and I, we're bonded by exhaustion and purpose. We know every corner of those halls. We know the temperature of the operating rooms, the specific way each surgeon likes their instruments arranged, the names of every patient on our floor. That night, it started like any other. I was 30 minutes into my 12-hour shift, reviewing charts and preparing patient files for the incoming surgeries. The coffee in the break room was cold and bitter, but I drank it anyway. I had no idea that within a few hours, my entire career would be questioned, and I would face a moment that would define who I am as a nurse. Dr. Marcus Chen was not a man you wanted to disappoint. He was 58 years old, with silver threading through his dark hair and a reputation that preceded him through every hallway of Jefferson Hospital. Dr. Chen had performed over 5,000 surgeries in his career, and he had never lost a patient on his table. That was his legacy. Perfection. His skill was undeniable. People came from all over the country to be operated on by him, but his demeanor was something else entirely. He demanded absolute precision from his team. Every instrument had to be exactly where he expected it. Every medication had to be prepared in a specific way. Every nurse who worked with him knew that one mistake could result in a public humiliation that would follow you for months. I had worked with Dr. Chen perhaps 30 times over my years at Jefferson. He had never raised his voice at me directly, but I had seen him reduce other nurses to tears. His standards were impossible, yet somehow his surgical outcomes were beyond reproach. Other surgeons respected him, but they also kept their distance. There was something cold about Dr. Chen, something that went beyond professional rigor. It was as if he believed that emotions had no place in medicine, that the only thing that mattered was the result. He never asked how you were doing. He never acknowledged the personal sacrifices his team made to be there at 3 a.m, away from their families, away from their beds. On the night, everything changed. I didn't know it yet, but Dr. Chen was running on only 4 hours of sleep. He had been at his private practice until midnight, performing consultations. He came to Jefferson Hospital irritable and tired, though he would never admit it. If you're already hooked by this story, hit that subscribe button now, because what's coming next is going to shock you. Being a surgical nurse is nothing like what people see on television. On why? Television. It's dramatic music and sudden emergencies. In reality, it's meticulous preparation and mental endurance. Every single day, I carry the weight of knowing that the decisions I make could mean the difference between someone going home to their family or not coming home at all. I arrive for my shift and immediately review the surgical schedule. That particular night, we had 4 major surgeries scheduled. The first was a routine gallbladder removal. The second was a knee replacement. The third was a hernia repair. And the fourth was a complex cardiac bypass. That last one was going to require absolute focus and precision from everyone involved. I spent 2 hours preparing the operating rooms, checking that every instrument was sterile, that every medication was properly labeled and organized, that the equipment was functioning correctly. You develop an instinct for this work. You begin to anticipate problems before they happen. I triple-check everything because I know that a single oversight could be catastrophic. My colleagues and I, we don't talk much about the fear, we just do the work. But it's there, underneath everything, this constant awareness that we're responsible for human lives. Some nights, when I go home, I sit in my apartment in silence for hours, replaying procedures in my mind, wondering if there was anything I could have done differently. I have a therapist I see twice a month because of this job. She tells me that it's important to process the emotional weight of what I do. But there's only so much therapy can do when you're carrying the responsibility of keeping people alive. That night, I felt it more intensely than usual. There was an electricity in the hospital, a sense that something significant was about to happen. I didn't know what it was, but my body knew. Thank you for staying with me this far. What you're feeling right now, that tension, that concern, I felt it too when I lived through this. So go ahead and subscribe. Turn on those notifications, because what comes next changes everything. His name was Robert Patterson, and he was 72 years old. He had been admitted to Jefferson Hospital 3 days before his surgery with heart complications that his primary care physician had been monitoring for months. Robert had worked as a high school history teacher in Philadelphia for 43 years. He had taught thousands of students about American history history, about the Civil War, about the Civil Rights Movement. He had been married to his wife, Dorothy, for 51 years. They had 3 children and 7 grandchildren. Robert's medical condition had been deteriorating gradually. His ejection fraction, the measure of how efficiently his heart was pumping blood, had dropped to 30%. That's when his cardiologist recommended the bypass surgery. Robert came to the hospital on a Tuesday afternoon. I was working that day, and I had done his preoperative assessment. He was nervous but trying to hide it. He told me that he had promised Dorothy that he would be fine, that he would make it through and come home, and they would take a trip to Cape Cod like they had always planned. I remember thinking that he had the kind of optimism that comes from a lifetime of believing that good things happen to good people. His daughter had been with him that day, and she held his hand while I inserted his intravenous line. Robert had asked me if I had ever seen a patient get through a bypass surgery without complications. I told him yes, thousands of them. I didn't tell him about the ones who didn't make it. I didn't tell him about the families I had seen destroyed by unexpected outcomes. I told him what he needed to hear, because that's part of nursing too, knowing when to be honest and when to offer hope. The night of Robert's surgery, I arrived at 4 a.m. to prepare the cardiac operating room. Jefferson Hospital's surgical wing is quiet at that hour, almost reverent. The hallways smell like antiseptic and cleaning solutions. The lights are bright and unforgiving. I went through my checklist methodically, checking the heart-lung machine, verifying that the bypass pump was functioning correctly, ensuring that all the specialized medications for cardiac surgery were accessible and properly labeled. Dr. Chen arrived at 5:30. He was already in his surgical scrubs, and he looked even more tired than I expected. His jaw was clenched. He barely nodded in my direction. I had learned long ago that this was normal. Dr. Chen was not unkind in the traditional sense. He simply did not engage in pleasantries. He was there to perform surgery, and everything else was irrelevant. The anesthesiologist arrived next, Dr. Patricia Olson, a woman I had worked with dozens of times. She was calmer, more personable. She asked me how I was doing, and I appreciated that, even though I knew she was asking out of habit, rather than genuine curiosity. By 6 a.m, Robert was brought into the preoperative holding area. I went to see him one more time before he went into the operating room. He was already sedated, but his eyes were still open, still alert. He looked at me and squeezed my hand. I squeezed back. I told him that Dr. Chen was the best, that he was in good hands. I meant every word. What I didn't know was that in approximately 2 hours, everything I believed about that statement would be tested. The surgery began at 6:45 in the morning. The first hour went smoothly. Dr. Chen made the initial incision with the precision of someone who had performed this exact procedure thousands of times. The bypass machine was activated, and Robert's blood was being oxygenated outside his body. This is the moment when a patient is most vulnerable, when they are essentially being kept alive by machines rather than their own heart. I was standing at the instrument table, monitoring every tool, every medication, every piece of equipment. Dr. Chen was focused entirely on the surgical field. He was in his element. Then, at approximately 7:45, something went wrong. It wasn't dramatic. There was no sudden alarm or emergency alert. What happened was that Dr. Chen made an adjustment to the position of the graft, the vessel he was using to bypass the blockage in Robert's heart. It was a subtle movement, barely perceptible to anyone not directly involved in the procedure, but I noticed it. I had been watching Dr. Chen's hands for 12 years. I knew his movements the way a musician knows the movements of a conductor, and something about this particular adjustment seemed unnecessary. In that split second, I made a decision that I will spend the rest of my life justifying or defending, depending on the person I'm talking to. I quietly said to Dr. Chen, "Doctor, are you sure about that repositioning?" It was not disrespectful. It was not aggressive. It was a simple question, a clarification, the kind of thing that happens in operating rooms every single day. But Dr. Chen's response was immediate and violent. He straightened up, his hands still inside Robert's chest, and he turned to look at me with an intensity that made everyone in the room freeze. "Nurse," he said, his voice low and controlled, but absolutely terrifying. "What exactly are you questioning?" I tried, to respond calmly. "I just want to make sure we're following the optimal procedure." That was when he said it, the words that would haunt me for weeks afterward. He looked directly at me and said, loudly enough for everyone in the room to hear, "Enfermera, o que você fez?" "Nurse, what have you done?" The room went silent. My heart rate skyrocketed. I felt my face flush. The other nurses and technicians in the room suddenly became very interested in their instruments. The anesthesiologist looked at me with sympathy in her eyes, and I realized in that moment that I might have just made the biggest mistake of my career. In the aftermath of Dr. Chen's outburst, I had to maintain my composure. This is something they don't teach you in nursing school, how to function in moments when you feel like your entire professional identity is under attack. My hands didn't shake, but my mind was racing. Had I been wrong? Had my intervention actually compromised the surgery? Was I about to watch a man die on the operating table because I had questioned Dr. Chen's judgment? The surgery continued for another 2 hours. Dr. Chen did not speak to me directly again. He communicated with the other staff members, giving precise instructions, and I responded to those instructions without hesitation. But there was a tension in that room that hadn't existed before, a weight that settled over everything. When the surgery was finally complete, and Robert was stable, being moved to the recovery room, I felt an enormous wave of exhaustion wash over me, but there was no time to process what had happened. I had to document everything, clean the operating room, prepare for the next procedure. It wasn't until my shift was ending, around 6 in the evening, that I finally sat down. I went to the break room and I cried. I sat there in that awful, fluorescent-lit room, surrounded by the smell of old coffee and sadness, and I questioned everything. Was I arrogant to question Dr. Chen? Had I endangered a patient who had trusted me with his life? My colleagues told me not to worry, that Dr. Chen's outburst didn't mean anything, that he yelled at everyone. But it wasn't their reputation on the line. It wasn't their career that felt suddenly fragile. I went home that night, and I couldn't sleep. I kept replaying the moment, wondering if there would be consequences, if Dr. Chen would file a complaint against me, if this would be the incident that derailed my career. Now I need to know from you, where are you watching this story from? Write it down in the comments. It's incredible to see people from so many different places following stories like this, connecting through shared experiences and understanding. The next morning, I woke up to a call from Jefferson Hospital. My heart sank. A call on my day off could only mean one thing. There was a problem. The voice on the other end was Dr. Patricia Olson, the anesthesiologist. She said, "Grace, I need you to come back to the hospital. There's something you need to see." I drove back to Jefferson in a state of panic. My mind was constructing worst-case scenarios. Had Robert developed complications? Had he gone into cardiac arrest? Had my questioning during the surgery somehow contributed to a negative outcome? When I arrived, Dr. Olson met me in the cardiac unit. She took me to a small office and closed the door. She pulled up Robert's test. Results on the computer. She didn't say anything for a long moment. She just let me read. What I saw made me understand everything. The post-operative imaging showed that Dr. Chen's original approach to the graft positioning would have resulted in inadequate blood flow to Robert's heart. It would have failed within weeks, maybe months. Robert would have returned to the hospital in emergency condition, possibly facing a second surgery, possibly not surviving. But the adjusted positioning, the one that I had questioned, the one that Dr. Chen had made after my intervention, was perfect. It had been exactly what Robert's specific anatomy required. Dr. Olson explained that she had reviewed the surgical recording with the hospital's chief of cardiac surgery. They had reached the same conclusion. My question had prompted Dr. Chen to reconsider his approach. His reconsideration had led to a subtle but critical adjustment. That adjustment had saved Robert Patterson's life. Dr. Chen had realized this before he left the hospital, and he had asked Dr. Olson to make sure I knew. Dr. Chen requested a meeting with me 2 days later. I was still nervous, still uncertain about what to expect. We met in his office at the hospital, a surprisingly modest space with medical journals stacked on shelves and photographs of his family on the desk. He asked me to sit down. For a long moment, he didn't speak. Then he said something that I didn't expect. To hear from him. "You were right," he said simply. "I was tired that morning. I was irritable. I made a decision based on habit rather than careful analysis. When you questioned me, I was angry, but then I realized that I had never considered that specific adjustment. And when I thought about Robert's particular anatomy, I understood that you had identified something important." I asked him why he had responded so harshly. He explained that in his experience, nurses who questioned surgeons were often acting from insecurity or inadequate training. He had assumed that was what was happening, but he had been wrong. "In this profession," he continued, "we have to be willing to be questioned by people we trust. You understood Robert's condition well enough to recognize a potential problem. That's not something I see very often." He told me that he had been in medicine for 34 years, and that he had lost patients along the way. He had also saved thousands, but he had never appreciated, as much as he did in that moment, how dependent surgeons are on the expertise and intuition of their nurses. Our relationship changed after that. Dr. Chen was still rigorous, still demanding perfection, but he treated me and the other nurses with a different kind of respect. He acknowledged our contributions. He created an environment where questioning and discussion were not just tolerated, but encouraged. And Robert Patterson went home to his wife Dorothy. He had complications. During recovery, minor infections that were managed with antibiotics, but he survived. He walked out of Jefferson Hospital 6 weeks after his surgery. And that experience 12 years into my nursing career taught me something fundamental about who I am and what this profession actually means. Nursing is not about blindly following orders or deferring to authority. Nursing is about advocacy. It's about being willing to speak up, even when you're terrified, even when you might be wrong, even when the cost of being right might be professional isolation. I think about Robert Patterson sometimes. I saw him once, about a year after his surgery. He was at the hospital for a checkup, and he recognized me. He thanked me. He said that his doctor had explained to him what had happened, that a nurse's question had led to a different approach that had saved his life. He told me that he had returned to teaching, that he had completed his final year before retirement, that he had taken Dorothy to Cape Cod, and that they were planning to return there every summer for the rest of their lives. I think about Dr. Chen too. He retired 2 years ago. Before he left Jefferson Hospital, he established a program specifically designed to encourage open communication and collaboration between surgeons and nurses. The program has been adopted by hospitals across the country. My decision to question him that morning, in those few seconds when I had to choose between silence and speaking up, changed more than just Robert's life. It changed how an entire generation of medical professionals will interact with each other. I still work the night shift. I still arrive at 3 a.m. and move through those fluorescent-lit halls. But I do it now, with the absolute certainty that my voice matters, that my expertise matters, and that sometimes the most important thing a nurse can do is speak up, even when it's terrifying. This is who I am. This is what nursing means to me. And I would make the same choice again, every single time.